start with is a brief overview from Dr. Lee, and then I will go through and ask each of you with your questions. We have quite a few online, so what we'll do is a question with one follow-up for now, and then we'll circle back if we have time near the end. So with that, if you could please go ahead, Dr. Lee.
Thank you. Just a sound check. Can you hear me?
Yes.
Great. I'm Dr. Colin Lee, Associate Medical Officer of Health here at Simcoe Muskoka District Health Unit. I'm just going to spend a few minutes just recapping what we know at this time and what we're doing. So at this time, we are aware of 6 local COVID cases attributed to this outbreak in Barrie that are highly likely to be of a variant strain of concern. It isn't confirmed, but the variant strain testing is a 2-part test. The first test detects a particular mutation that's positive. That is found in the variant strains of concern, being the UK, South Africa, or Brazil. So as far as we know, it's a very, very high probability that this will be one of those 3 strains. The second part of the test is a whole genome sequencing test where they look at every piece of DNA of the strain, and that takes a number of days. We expect that in the next few days, and that will provide us with the definitive answer. This has been a very tragic and heartbreaking outbreak. Just to give you some context, it's a facility of about 130 residents, and within 48 hours of learning of the first positive case, we learned of it January 8th. We declared an outbreak. We had upwards of about 55 people becoming ill within 48 hours. This is tremendously rapid. And as of now, as far as I understand it, we have 122 residents confirmed positive. We have, unfortunately, 19 deaths in COVID positive residents. We have 5 residents at the hospital. And we have 69 staff confirmed positive. Unfortunately, the vaccine, the ability to move the vaccine came a little bit late. We did as quickly as we could, went in there on Saturday and immunized as many as we could. We immunized 21 residents, as you can appreciate. Most were already infected. We did immunize 135 out of 268 staff and caregivers, the majority being staff. I would like to really say that everyone has been working collaboratively to fight this outbreak, including obviously the home staff, the caregivers, management, and with the help from Aurelia Soldiers Memorial Hospital, Red Cross, Georgian College, Ministry of Long-Term Care, County of Simcoe. I know I've missed many. And our hearts go out to the staff, the families, the residents of this outbreak, unfortunately. Just to let you know, among other measures we are currently putting in place, we're putting more efforts on our contact tracing to reach all close contacts as quickly as possible so that they can quarantine or self-isolate if necessary. We're also in discussion with Public Health Ontario on other measures such as increased testing in the home and among those who are close contacts who are quarantining as a result of this exposure. One of our primary goals right now is to prevent the spread further as it gets potentially into households, into other hospitals, as we have residents being transferred. So we are doing this in order to try to prevent that spread as well, as much as possible. So thank you. I'll pass it back to Kathy.
Okay, thank you, Dr. Lee. Let's start with Barrie 360. I believe you're on the line. Do you have a question for Dr. Lee?
Yes, thank you. I do. We've heard that some variants are more communicable than the average, but were we surprised at the spread of, well, rather at the speed at which this spread?
It was very early on that we certainly were contemplating, and many were thinking that this has to be the variant, and at least a good possibility of it. And, the variant of we know most about is the UK variant, which the UK has done quite a bit of studying, and it does show that it is, they estimate about 50% more contagious. For the other variants that have the same mutation, although we don't have as much data on it, it is thought that it does possess that characteristic of increased contagiousness. Why is it more contagious? Certainly what we have seen from the science from the UK is that it seems that when a person gets infected with the UK strain, the viral load, the amount of virus is very high very early. So that makes it more virus to pass on to the next person. Second of all, we know that mutation allows the virus to bind more easily to the human cell, and therefore may need less virus to bind, or at least it binds more easily. So those two things we know, that's what the consensus is at this time. But we expect that variants of this mutation that we've detected to have likely to have a similar high contagiousness.
And I don't know if you'd like to speak to this, Doctor, but we've heard the term iron ring in relation to long-term care homes to the point it's actually cliche. But do you believe that there were any prior steps that could have been taken by any level of government to have lessened this, or maybe even prevented it altogether?
I'll be honest with you, with the rapid speed that it went, knowing that this home did everything they needed to do to prepare, I doubt that it would have prevented an outbreak for sure. And how much of it could have been prevented, it's hard to know. But I do know everyone did what they could in preparation. We will be studying this, obviously, to have ensure that we learn from this and to have better preparations as much as we can for other homes.
Thank you for your time today.
Thank you, Dr. Lee. Karen Howlett from the Globe and Mail. Go ahead, please.
Oh, thank you. Dr. Lee, I just have some questions about the those who were vaccinated. So you said 21 residents were vaccinated on Saturday, but we know that almost every resident is now sickened with the virus. How many staff are there in the home, and of those, how many were vaccinated?
So we don't have exact numbers for staff, because what we have are the number of caregivers and staff immunized. We have 135 that are immunized, majority being staff. I don't have an exact number, unfortunately. And we know that's about 69 staff. What we have is we have staff there, but we also have a lot of staff coming in at this time. So because there has been a need for additional staff.
Have some people been reluctant to work in the home because of the announcement yesterday? Like, are some people refusing to work?
Yeah, that's a very good question. As far as I know, there isn't, but that is a true concern. I do know that this outbreak has had everyone thinking about the variant, as well as just it's been a tremendously severe outbreak. And I commend the staff. The staff have been coming back once they're cleared to work. The problem is with an outbreak of this size, you actually need a lot more staff than what you normally have. So they were down staff because they were ill. But as far as I can see, most, if not all, have been willing and when able to come back. But of course, with this new news, this may deter them. But I haven't seen that. And we are ensuring as best we can that anyone going in gets the opportunity to get the vaccine, even though we're not getting any more vaccine this coming week, as you know.
How are you doing that if you're not getting more vaccine? Sorry.
That's a good question. We have a small amount of vaccine left that we have to juggle between the second doses that are needed, the rest of the rest and retirement homes. There's some difficult choices we have to make, but this is absolutely the top priority for immunization at this time. We just discussed it this morning. It's not an easy decision, but that we have decided that they are the top priority. So whatever we have available, we will certainly make it available to anyone entering that home.
Thank you.
Thank you, Karen. Karen, excuse me. Lorenda Redicop, go ahead, please.
Hi there. I've seen an urgent call out from the Ontario PSW Association for staff willing to go into that home. I guess you sort of addressed this a little bit, but I mean, if there is this urgent need, like, I don't know if you're speaking with the government or what needs to be done. Is more pay?
Yeah, we've been speaking with the various ministries, in particular the Ministry of Long-Term Care, and the Red Cross. We're trying to get staff from everywhere in order to ensure there's adequate staffing. In terms of for PSWs, there are certainly systemic issues that we need to address. That has been well known up to now. The pay certainly is not seen to be adequate. Secondly, sick pay needs to be addressed in a way that does not deter them from declaring that they're ill. But certainly we are working with the various ministries, with the home, with the Red Cross, with Georgian College, with the County of Simcoe, to come up with a robust plan to ensure adequate staffing.
I don't know if you could just paint a bit more of a picture of what it's like there, what staff are going through.
I could try to paint a picture, but I would not do it justice. Having said that, I have spoken to people who have been on the inside. I do know that there are certain certain activities, certain medical activities, medical duties that need to be done. They're having to prioritize it. That's what they have to do. And what used to be maybe every a couple of hours they needed to do, they might have to stretch that out. It is becoming very difficult. It has been difficult, I should say, for them, because they all want to provide the best care to everyone there. But I do know that they are trying their best and prioritizing. And I think it has been improving in the last number of days. It was very difficult for a few days, I think, the last week. But I believe that things are improving.
Thank you, Lorenda. Mike Walker from CTV, do you have a question for Dr. Gardner, or sorry, Dr. Lee?
Yes, yes, I do, and thank you for taking my question. I just want to kind of go back, Dr. Lee. Can you kind of walk us through how this variant was first detected and how it's believed it got in the home?
Right, that's a good question. I think we've had something like 15 cases in Ontario. Some of them do have a travel history, either personally of that case or been in contact with a traveler who was infected. There's been a small number as well where there is no connection with travel. So we do know that it may be in the community already, after the second generation where there is no travel connection. In terms of how this got in, certainly there's always a possibility that it was in the community already, and it somehow got in because as much as everyone is trying their best to prevent transmission through IPAC practices, proper infection prevention control practices, this virus is very stealthy and can get through human behavior. Having said that, we do know that the first case did have a contact, close contact with someone who did travel outside the country, and also came back and became ill while quarantining. Now, what we know is that they did not travel to the three areas of most concern, which is the UK, South Africa, and Brazil. But variants can obviously occur naturally and can occur anywhere, and can already have traveled to a different country. So there is a likelihood that there was a travel connection, given that the variant strain in Ontario is relatively early. But having said that, we have seen variant strain cases now of persons with no connection with travel, and it could have been a second generation from a previous traveler a little while ago.
Right, and my follow-up is kind of a two-parter. Just on the first part is on how it got in the home. Was that a staff member who tested positive? I know your colleague, Dr. Gardner, may have mentioned that to other reporters. That was a staff member who was asymptomatic with that variant. And my second part is just following up with my colleagues about the current staffing situation there as well, if you don't mind.
Sure.
Are there currently staff members?
Current, right. So, the staff member did everything correct. She was not symptomatic. Every week there is testing done for all staff. She was asymptomatic. She got tested. And while awaiting the results, a day or two later, she became ill and did what she should have done. She went home and self-isolated. The result was positive, came back positive the next day. So the test took about 2 or 3 days. So that's what happened with the first case noted. And then within 48 hours, we had about over 50 people ill. Your question on the staffing situation at this time, I think the staffing situation, from what I understand, is it is still concerning. It's improving, but I don't think we're out of the woods. But it is. I think it has been improving for the last few days.
And sorry, if you don't mind, I just want clarity on that first part of that question. When I was asking about if it was a staff member that brought in, was that the variant that the staff member brought in?
So this first discovered case, this first discovered staff case, is one of the 6 cases that have tested positive for the mutation that is very common in the variant strains. So yes.
And do you know which variant? Sorry for asking info.
Right, no problem. So at this time, all we know is that it's a high probability of one of the 3 variants, and we should know which variant within a few days.
Thank you.
Thank you, Mike. Let's go to Erica Engel from Barrie Today.
Hello, is my volume okay?
Yep. Hi,
Thanks.
Erica.
Hi. Thank you for being available for questions right now. My question relates to the vaccine. I know that Simcoe Muskoka was supposed to get Moderna. It was rerouted, and it took a while for the province to tell you that you could start moving Pfizer. Had that information come earlier, or had the health unit got Moderna, could these people have been vaccinated before the outbreak started?
You know, the painful short answer is absolutely. I could only wish I could turn the clock back. If we had vaccine a month before we went in on Saturday, I think this outbreak would be a lot less severe. It's unfortunate that we were not able to move the vaccine we have had. And you're right, with the Moderna, we had a lot more flexibility, and we would have moved it in right away. These are the people we're trying to protect. And we have, as a side note, we finished that weekend immunizing all the long-term care home residents.
That weekend, as in January 8th?
Right.
Mm-hmm.
Last weekend, Saturday.
Okay.
Yeah, I'm sorry. Yeah.
Yeah. You said you're going to study this, but are there any lessons you have already learned from looking at this outbreak that could be applied to other homes or situations?
You know, I think that it just confirms how contagious this virus is. You know, everyone, especially in the home, are well aware of the consequences and severity of this illness on residents and staff there. And I know they did everything they needed and wanted and were told to and recommended to do. And despite that, within 48 hours, we had 55 cases. And I think, redoubling our efforts on what we need to do, I think we really need to look more deeply into what else we can do. What other precautions are out there that we haven't looked into that we might want to do? But the first lesson is the vaccine needs to get into the arms of long-term care home residents. That has been unfortunately painfully obvious.
Thank you very much.
Thank you, Erica. Let's go to Sarah Law from Muskoka region. Sarah, go ahead, please.
Hi, Dr. Lee. Given the variant is much more contagious, will there be increased efforts to protect frontline workers and their families across the region?
The short answer is yes. We've been very successful in collaboration with Royal Victoria Hospital and in immunizing as quickly as possible what vaccine arrives at our doorstep. And in many ways, we're a victim of our own success. We keep on having to rejig our schedule because we keep running out of vaccine. And so, as soon as we get vaccine, we are going as fast as we can to the highest priority groups.
Thank you. And what would you say at this point is your greatest concern about the variants?
With the variant strain, two concerns. One is just even though there is no evidence that when you're infected, the variant strain is more severe, can cause more, you have a higher chance of having more severe illness in you. The problem is that this spreads so quickly and to so many people that ultimately with more people ill, you're going to have a higher chance of more people severely ill and deaths. So that's one, just a numbers game. We need to immunize as quickly as possible before this variant strain gets to as many people, especially the vulnerable. Second of all, I'm afraid the cat is sort of out of the bag now. That this will, by evolution, by spread, will become potentially a dominant strain, this variant strain, in the next weeks, months, and we need to try to slow that spread of this variant strain because clearly it's not the preferred strain for us. There's also the lingering question in my mind, which we don't know the definitive answer, is how well does the vaccine work against the variant strain? We've been reassured that it is likely going to work well, and also reassured, at least by the vaccine manufacturers, that they could quickly pivot and change the composition of the vaccine in order to match any variant strain if needed.
Thank you, Sarah. We have some people I'm unsure of where they are from, but we have CTV Toronto. Are you able to go ahead and perhaps tell us who you are? CTV Toronto?
Those are all my colleagues who are helping record this.
Oh, okay. Thank you, Mike. Let's go with Denise at Canadian Press.
Hi, yes, thank you. Question for Dr. Lee, is your public health unit testing other long-term care homes for this variant?
So that's a good question. So the way the testing for the variant strain occurs is it requires a positive regular COVID test first. So that's the first step. And then the second step would be to do the variant two-step testing. So it's really, it would be a 3 steps to that. At this time, there is certainly criteria around people who are with a travel history or contact with someone with a travel history who's tested positive. For other long-term care homes, I think, that is, we're going to have that discussion with the province as well as the lab on where else do we need to test in order to find out where this has gone to. I think certainly the long-term care homes would be a target given its vulnerability. But that hasn't been decided. But at this time, we all obviously did the testing on this outbreak because of the characteristics in the first 48 hours. It was very quick, but more routine testing of the variant in long-term care homes, I think that's a very good question, and certainly we're in discussion about that.
So just to check, you said that the virus was spreading fast. That's why you tested for this variant. Okay. Yeah, that's just my question. No follow-ups. Thank you.
Yeah.
Okay, thank you, Denise. Sean Gibson, do you have a question for Dr. Gardner? Or sorry, Dr. Lee. My apologies. It was a long day yesterday.
Yeah, I do. Thank you. And I want you to pardon the length of it, if you don't mind. We're just trying to clarify something. On Saturday, Dr. Kelly Wright, who we understand has been in Roberta Place helping, told the national newspaper that 109 of 102 residents had positive tests, and nearly all staff. We were in contact with Roberta Place, and those numbers were significantly off. We reached out to Dr. Wright. She said that she was misquoted, and that the numbers we had from Roberta were accurate. We understand that yesterday the national newspaper she spoke to had said that she was not misquoted now. Essentially, with all the mistrust already in the community and fear, it kind of feeds it. We're just trying to figure out what happened. I mean, it's obvious that numbers rise, but Dr. Wright's initial numbers were somewhat close to what they are now, and people are questioning what's coming out of the facility. What's Dr. Wright's role there, as well as what happened?
Sure. I think, Dr. Wright has been very critical to the operations there. Each facility usually only has one medical director, and that medical director, reached out to his colleagues, and Dr. Wright, stood up and went in fearlessly. So she's in there to help the medical director provide medical care and direction for the residents. That's what her role is. I am confident that in terms of the numbers, that we are trying our best collectively to have the most accurate number at any point in time. What you got to appreciate is that the numbers change very rapidly, and that there is a transfer of information as well from one person to the next, one party to the next. So there is certainly a good possibility the numbers were right, or were a little bit off, or very off, based on the changing numbers and the difficult calculations that need to be done. But I can assure you there is no way, shape, or form of anyone trying to hide the numbers, change the numbers, play down the numbers, increase the numbers. We're all working on the same team, but it has been tremendously, a difficult outbreak, and this is just one of those things that has been difficult to pinpoint, day to day, and sometimes hour to hour.
Thank you. And just to follow up, in your opinion and your advice, when we follow the numbers, we reach out to Roberta, we bother Kathy at the health unit, we're all over the place. Who would you say would be the most accurate facility or organization to get those numbers out?
Yeah. So, I think I would suggest that you come to us. because we do receive the results, we investigate the results. Results can be falsely positive, falsely negative. The home certainly gets the results because it's their residents. They don't necessarily get the results for the staff. I appreciate everyone's trying to provide the best answer at that time. But I would also suggest that, for consistency sake, and for the fact that we are investigating each result, and it is our duty to, to have the most up-to-date numbers, that you approach us first.
Thank you very much.
Okay, thank you, Sean. Matthew Riesler from Moose FM, go ahead, please. You're muted, Matthew.
Hi, yes, I have no additional questions.
Good, thank you. Do we have Chris Simon on the line? Okay, Sean McInnes, are you with, doesn't say what publication you're with.
Sean's my camera guy.
Oh, okay. Okay.
You have a lot of guys, Mike.
I use all the resources I can.
We sure do. Well, let's cycle back to Lorinda Redikoff. I know you had a question.
Yeah, thank you very much. And thanks for this. This is amazing. I just wanted to check because kind of going off of those high numbers that we had heard about, it had a lot of people calling for more help to be going into the home. The Army has been brought up. You did talk about that there has been some help in terms of staffing that's come in, but is more needed. And also because in some homes we've heard about difficulties with when we have so many cases, then the extra hospital help is an extra challenge as well.
In an outbreak like this, there's no ceiling of how much help we need, because there are just so many things that can happen. Staff being infected, staff being off, and the care is complex at the best of times, let alone when you have many ill and many severely ill, and a proportion of them severely ill. So I think even if for argument's sake we feel we have enough staff today, it is incumbent upon us to have a plan to have even more staff on the ready. So we've been reaching out consistently, constantly to all parties to ask them what they can offer as opposed to what we need as the minimum.
So in terms of the Army?
I think that has been brought up many times, and we have certainly conveyed that ask from the home as well as from the management, as they obviously have resources. And from what I understand, this is being entertained at the provincial level, given that the request for resources from the military is an intergovernmental request from the province to the federal government via the Canadian Forces.
Okay, thank you. Let's go with Chris. I will probably mispronounce your last name. Erhold from CP24.
You got it right. Thank you. Dr. Lee, I just want to talk about the PCR test you're using to try and find the little deletion or the variant, the little signal you need to forward it on to genomics. The feds say that the UK variant shows a deletion, but that the South African and Brazilian do not. Could you clarify, have we advanced our procedure somehow there?
That is actually news to me. I do wish that our Public Health Ontario lab colleagues are here. From what I understood, the 501 mutation was one that was detected, and that could lead to the possibility of the variant being one of those three. I will, after this call, reconfirm with my public health lab colleagues on your understanding that the deletion would only be found in the UK strain. Is that what I understand that you got from the feds?
The microbiology lab told me exactly what I just said, that B117 shows up on PCR and that the others do not have a tell, so to speak, and you can only detect them through genomics.
Right. I don't know what to say, okay, except that that's our understanding of it. Right. I think that's, that obviously has relevance. I think, the other relevance is that if it is a variant strain of those three, it is still likely, going to be, the other two is going to be as contagious as the UK strain. But that's a good point. I will follow up on that, Chris, and Kathy, can you take note of that so that I can circle back to Chris with an answer?
And
absolutely.
I just wanted to follow up also, the index staff case, the first of the six, had close contact with someone who traveled abroad. Where did that person travel abroad to? Right.
So I'm not at liberty to provide an answer in order to protect the identity of the staff person, because the staff community is small. But what I can tell you is they did not travel to UK, Brazil, or South Africa.
Okay, thank you.
Thank you, Chris. Let's circle back to Karen Howlett at the Globe and Mail.
Oh, thanks so much. Doctor, I want to follow up on the question Erica from Barrie today was asking. Can you just elaborate a bit, please, on the fact that Simcoe Muskoka was supposed to get the Moderna vaccine, but it was rerouted?
Sure. It was a number of weeks ago where we were expecting our first batch of Moderna vaccine. And we were planning then to go straight to the long-term care homes with it. That was a few weeks ago. And it was rerouted, as far as I understand it, from the provincial government to areas in the province of highest need. So if I understand correctly, it went to places like Toronto, where there is higher incidence of COVID-19, and it was then subsequently used for long-term care homes there. So in essence, the long-term care homes in the highest incidence areas, such as Toronto and other areas, mainly around the GTA, received a Moderna vaccine that was destined for us, and not only us. There were some other, many other places in Ontario that had their Moderna rerouted.
Thank you. So the vaccine that was administered on Saturday, that was the Pfizer vaccine?
That's right. That's all we have is the Pfizer vaccine, and it was hardly a few days or before that we were given the go ahead to be, about a week before that, the go ahead to be able to move it, and move it in a way that we don't normally move it in a vaccine. It was really with extra care, and after bringing it out to the long-term care home, we were not able to restore it, and so we could not waste anything that was already gone out. We had to use. So it was there was a lot of calculation as well as care that needed to be taken for a very fragile vaccine.
Okay, and this isn't a question, but I just want to add, given that the unnamed national publication where Dr. Wright, it was claimed that she was allegedly misquoted. According to my colleague who did the interview with her, she was absolutely not misquoted. So I just want to set the record straight, given that the Globe and Mail, even though it wasn't named, was maligned in that. So.
Yeah, I'll be honest with you. I didn't read that article, so I'm not sure what was said and specifically, but thank you.
Okay, thank you, Dr. Lee. Dana Goldfinger from Global. Do you have a question for Dr. Lee?
I do have a question. Hi, Dr. Lee. Thank you for doing this news conference today with all of us, or this Q&A. One question I have is sort of about the spread of the virus, the variant in the home. I know obviously it's more contagious than what we've been seeing in Ontario and in Canada in the past, but how exactly did it spread so quickly?
That's, you know, that's a great question. Obviously, there is no certainty on that answer. As I mentioned early, when I started, what we do know is that from the UK experience, because they've had the most of this variant and they've actually studied it, at least epidemiologically, that persons who are infected with this variant tend to have a higher viral load. What that would mean is, at the beginning, what that would mean is that higher viral load would allow you to shed more virus or shower more virus on the person next to you. And with that, it may be able to, even with, you know, protection is not 100%, can get through that protection, whether it be a mask, whether it be a gown, whether it be a eye protection. That's one. Secondly, the virus itself can attach to human cells more easily, and therefore, when you get five virus particles coming at you from a variant, you know, all five might stick to you and infect you. Whereas if it was not the variant, maybe only two, and the three others will bounce off you, or you are able to smack it back, you know, to outer space, so to speak. So those are the two working hypotheses, I think. With the first one that I described, probably has a little bit more evidence on that, and there may be more to come. But what that really tells us is that we really do need to concentrate on the measures that we're taking even more. You know, that physical distancing becomes that much more important. You know, if you can physical distance yourself, and instead of going closer and wearing protection, that's what I would do, because you know, it's being further away from that person does help, and don't be, you know, if you, even though you're wearing the full protection, be aware that we're all human, and we make errors in putting it on and contaminating ourselves with it, taking it off. And the virus just maybe, it looks like it's more able to penetrate those defenses, however we, imperfect or perfect, we're trying to put it on.
Okay, thank you for your answer. And then follow-up question, given this development of a variant being present in the home, what do you think this means for the greater community, both in the region, but also Ontario and congregate settings throughout the region and the province as well? Yeah,
I'll be honest with you. I think everyone is just a little more fearful today than they were yesterday morning. This is more contagious. It's here. You know, there's a good chance that it is going to slowly spread, you know, within our area, not only within our area, but other areas in Ontario. We need to stay vigilant. We need to stay vigilant with all the public health measures, the physical distancing especially. And when you are wearing your mask and your eye protection, you need to be vigilant in wearing it all the time, and putting it on and off correctly. And you know, I think the thing that can help mitigate this all is we need to get vaccine in arms as quickly as possible, especially in the vulnerable. The long-term care homes, the rest of retirement that we've done, but the rest of retirement homes, the congregate settings, the healthcare worker staff, our elderly, we need the vaccine now.
Thank you.
Thank you, Dana. Now we have a number of people on the line. I'm not entirely certain if they are media or not. So is there another media outlet online who has not had an opportunity to ask a question of Dr. Lee? Okay, is there anyone else on the line who would like to do a follow-up call with or question with Dr. Lee? Okay. Oh, okay.
Sorry, I do. Hi, Karen Howlett again. I'm just wondering, are there any, because of the fear that this could spread or has spread so rapidly, are any special measures being taken to help staff, say, isolate from family members, like to accommodate them, say, in hotels or something like that?
So that's a very good question. I think even before these results, from what I understand, some staff have chosen and decided to isolate away from their families, not isolate, but quarantine or live while they're working there away from their families. And certainly that is an option that we're looking at. We're also looking at options on people who've been exposed, been in close contact with people who've been infected in this outbreak. What additional measures for quarantining and testing that we should be doing to decrease the likelihood of it spreading further.
Thank you. When you say you're looking at it, would that include compensating staff, like for any cost to stay somewhere else?
I think, from what I understand, and this would be a question better answered by the operator. From what I understand, the operator has been offering assistance to staff members who have decided to, or agency staff or other staff coming in to have different living arrangements in hotels versus their homes. That's from what I understand, but it would be better directed at David Jarlett, the operator.
Okay, thank you.
Thank you, Karen. So I'll just ask one more time. Do we have any follow-up calls for Dr. Lee?
Just one more question. I think I missed a little bit of the beginning. Just want to confirm if the case numbers at Roberta Place are still the same as yesterday among residents, staff, and essential visitors.
Yeah, the numbers I have are from yesterday. They're in the process of meeting at this time. We get our daily numbers. We have 122 residents confirmed, 69 staff confirmed. That's what we have. I think that was what was provided yesterday.
Yeah, okay. And still 19 deaths.
That's right.
Okay, thank you.
Okay. Thank you for joining us today, Dr. Lee, and thank you for everyone else on the line for joining us. We appreciate the questions. Thank you very much.
Thank you.
Have a good day.